Welcome back, my dear students. Today we are going to learn about nephrolithiasis, also called as kidney stones. This happens when urine becomes oversaturated with salts like calcium, oxalate or uric acid, leading to crystal and stone formation inside the kidney. These stones may stay in the kidney or block the ureter, causing severe flank pain, back, blood in urine, infections and swelling of the kidneys. Risk factors include high water intake, high salt or protein diet, hot climates, metabolic problems and family history. The good news is with proper hydration, diet, medicines and sometimes minimally invasive procedures, kidney stones can be treated or prevented. Nephrolithiasis or kidney stones. Introduction. Nephrolithiasis is basically a condition where hard crystalline deposits or stones form inside the kidney's collecting system in the renal pelvis or calyces. These stones are made up of substances normally dissolved in urine like calcium oxalate, calcium phosphate, uric acid, struvite or cystine. Sometimes the stones just sit quietly in the kidney, but if they slip into the ureter, they can block urine flow, leading to severe flank pain, that is renal colic, often described as one of the worst pains ever, blood in urine or hematuria, recurrent infections, hydronephrosis or swelling of kidney due to back pressure. It's a multifunctional disease influenced by diet, dehydration, metabolic errors, genetics, infections and lifestyle. Not surprisingly, it is one of the most common causes of recurrent urinary problems worldwide. It is the kidney stones in the minor and major calyces of the kidney. This is the kidney stone in ureter. This image illustrates nephrolithiasis, also known as renal calculi or kidney stones. Inside the kidney, crystals form when the urine becomes oversaturated with minerals and salts such as calcium, oxalate and uric acid. These crystals can grow into stones and either remain in the kidney or move down into the ureter. When stones block the urinary tract, they cause urinary obstruction, leading to severe pain, renal colic, blood in urine, or infection. In summary, the diagram shows how excess minerals in concentrated urine, crystal formation, stone growth, or obstruction in urinary tract. Risk factors. Think of them as stone promoters. Dietary. Too much oxalate rich food like spinach, nuts, tea, chocolate. High salt and animal protein. Too little water intake. These are the dietary reasons for the kidney stone or actor stone promoters. Metabolic or physiological. Hypercalciuria, hyperoxaluria, hyper uricosauria, low urinary citrate which normally prevents stone. Genetic, family history or inherited disorders like cystinuria. Hot, dry climates causes dehydration, concentrated urine. Other medical conditions like recurrent UTI, urinary tract infections, which causes starvite stones, gout, obesity, diabetes and hyperparathyroidism. Pathophysiology or how stones form. You can imagine the process like sugar crystals forming in a supersaturated solution. Supersaturation of urine, too many stone forming substances like calcium 2 plus, oxalate, phosphate, uric acid, cystine. Nucleation. First tiny crystals appear, crystal growth and aggregation, they clump together and get bigger. Retention and stone formation, crystals get trapped in renal papillae or calyces, stones form. Clinical effects, pain, obstruction, infection, hematuria, etc. Management of kidney stones depends on stone size, type and symptoms. Conservative, medical for smaller and complicated stones. Hydration, drink 2.5 to 3 liter per day, keeps urine dilute. Dietary tips, cut down on salt and red meat. Don't overly restrict calcium. Moderation is key. Avoid oxalate rich foods if prone to calcium oxalate stones. Thiazide diuretics reduce calcium excretion, potassium citrate increases urinary citrate, alkalinizes urine, allopurinol useful in uric acid stones, antibiotics for infection related starvite stones, interventional surgical for bigger or stubborn stones. ESWL, extracorporeal shock wave lithotripsy, sound waves break stones into smaller fragments. URS, uretoscopy or PCNL, percutaneous nephrolithotomy, endoscopic removal of large stones. Stenting keeps urine flowing when obstruction is severe. In summary, you can say that kidney stones is the crystals in urine gone wrong. They hurt, they recur, and they love dehydration and bad diets. But with hydration, diet control, meds, and sometimes surgery, they can be prevented and treated. So in this class, we have learned that nephrolithiasis or kidney stones occurs when urine becomes overloaded with minerals and salts, leading to crystals and stone formation that can block the urinary tract and cause severe pain, bleeding, or infection. The main risk factors are dehydration, unhealthy tips, metabolic problems, and genetic tendencies. The good news is with adequate hydration, dietary care, medicine, and modern minimally invasive procedures, most stones can be managed and prevented from coming back. Remember, drink enough water, eat wisely, and seek timely medical help. Protect your kidneys, stay healthy, and keep learning. See you in the next class. Thank you.